Hello, my name is Guiliana Nava, and I have been a staff nurse in an acute medical surgical floor for the past year. I graduated Salve Regina University in 2010 with my bachelor's. And today I'm here to talk to you, prospective and current nursing students, about a couple of things I struggled with in my transition from being a student nurse to a registered nurse. So the first one being, I had a hard time speaking to doctors. As many of you know who are in clinical right now, we don't really have the chance of interacting with the doctors. Usually when we have a question about the patient or if we have any concerns, we usually go to our clinical instructor or we go to the nurse who's taking care of that patient and we ask questions, we talk about the treatment, we talk about the care plan. And that can be a very challenging and intimidating thing to do as a new grad. You're in a new environment, you're taking care of all these patients, and you have to talk to them because obviously you're part of a team. One of the things that helped me with my struggle was definitely gathering all objective data before talking to them. For example, if you are a new grad and you have Mrs. Smith in 364 and she doesn't look too good, she may be a little sweaty, having a hard time breathing, she's having some chest pain, so obviously you have to call the doctor. You call the MD and you say, "Hello, Dr. So-and-so, my name is Guiliana, I'm taking care of Mrs. Smith in 364. And she doesn't look too good. She's having some chest pain, she's having a hard time breathing, she's a little sweaty. What do you think?" The doctor's probably going to laugh at you. What you should do instead is, as soon as your patient tells you, "Oh, I'm having chest pain," and you see that they are having a hard time breathing and they are a little diaphoretic, take a set of vital signs, check their pulse, check their blood pressure, ask for their pain, ask how bad is the chest pain from zero, give them a numeric scale, ask if it goes anywhere else, if it goes to the arm, if it goes to the jaw, if it goes to the stomach, if she feels like she has to throw up. Does anything make it better, anything make it worse? When did it happen? Is it still going on? And then see their pulse ox to see if they might require some oxygen. And then she's a little diaphoretic, so maybe checking a blood sugar wouldn't be bad. Check a blood sugar, get an EKG, and call the doctor. While you're doing all those things, you can ask the secretary or one of your colleagues to call the doctor. As soon as the doctor calls back, what you can say is, "Hello, Dr. So-and-so, my name is Guiliana, I'm taking care of Mrs. Smith in 364, and I'm concerned about her because she's having some chest pain, which is an 8 out of 10, and it goes from the chest to the left arm and also to the jaw. She has had some nausea, she's a little diaphoretic, but her blood sugar is fine, is 110. And you can say, "I already got an EKG, would you like me to start drawing some labs, and could you please come to the floor to see them?" They definitely need the objective data when speaking to you. It will make your assessment much easier.